Okay, well, we're 2 minutes past the hour, so let's get started. I'm Mike Drummond from the University of York, and I'm going to moderate this webinar on extensions to CHEERS 2022. I'd just like to thank NICE for hosting the webinar, the HTX project that funded the CHEERS-VOI, which Jamie will mention later, and those ISPOR task force members that supported the groups doing these extensions. So let me just share my screen. Okay, I hope everybody can see that. I'll just give a brief introduction to the presentations. So first of all, I'll mention briefly what CHEERS 2022 is. And secondly, why extensions to CHEERS might be required. That's a particularly important question because we're hoping that amongst the audience here, there may be some people that are thinking that of a possible extensions to CHEERS and would like some advice on that. And I'm sure in any case, you can learn from the experience of people that developed CHEERS-VOI and CHEERS-AI. So CHEERS, the original version of CHEERS was published in Value in Health and in some other journals in 2013. And it's basically about how best to report pieces of research, and in this case, economic evaluations. And it was a report of the ISPOR Health Economic Evaluation Publication Guidelines Good Reporting Task Force. And it was produced, as I say, by the task force. And the methods that were used were the methods which are typically used in development of guidelines under the auspices of an organization called Equator. And you're probably very au fait with guidelines like Consort for clinical trials, PRISMA for systematic reviews, and so on. So the methods were, first of all, to review any existing guidelines for economic evaluation at the time that the CHEERS group was formed, and then assembling a Delphi group to vote on a short list of reporting out items, and then making final decisions on the reported items would be included by the task force. And as I mentioned earlier, the CHEERS initiative was co-published by around 15 health services research and clinical journals. The most prestigious of the lot, I guess, would be the BMJ. And all of those journals reported the actual statement. That's the list of reporting items that we're recommending. But the long version was reported in Value in Health. So if you want any explanation behind some of the development of the reporting items, go to that paper that I just showed in Value in Health, at least for the 2013 CHEERS. And we were fortunate that CHEERS was adopted by Equator as one of its series of reporting guidelines, which we were very pleased about because I think it did give us some kind of status and not quite put us on the level with Consort, but I think it put economic evaluation on the list of types of research that deserved a reporting guideline in the Equator series. And the citations for CHEERS are now well over 2,500. So CHEERS 2022, the work for that began in around 2020, and we had the same original members of the CHEERS task force, but added some other people for diversity, both in gender and in geography. And we also added one or two people that had particular editorial experience. Daniel Mullins was the editor-in-chief of Value in Health, and Lisa Corley has written quite a lot on the use or non-use of these reporting guidelines. The other innovation in CHEERS 22 was to have a patient and public engagement and involvement group, which was chaired by Sophie Stanislewska, who has quite a lot of experience working with NICE and patient groups. And Sophie coordinated a small group of about 5 patient representatives who reacted at every stage to what was being proposed by the task force, and actually made some quite important changes in the wording of items to make them more relevant to patients. And most importantly, argued successfully that CHEERS should include 2 reporting guidelines, particularly focused on patient and public involvement. One asking the authors to report whether they did have any public and patient involvement in their research, and secondly, to report on any outcomes or changes that resulted from that involvement. So the new checklist is a little bit longer than the 2013 one and consists of 28 reporting outcomes. And they're organised in sections in the same way as the original CHEERS. First of all, the title and introduction to the study are 3 items. Study methods, around 17 items. Study results and discussion, about 4 items. And 2 items dealing with funding and conflicts of interest. And much of that is fairly standard. Those of you that are familiar with economic evaluation methods would recognise that the reported items relate very much to the key steps that one might have to go through in undertaking an economic evaluation in healthcare. And the 22 version is published also in Value in Health at the beginning of that year. And the CHEERS checklist is published in the early January or 2nd January issue of British Medical Journal. So one important thing to mention is, what does it mean if an item is in the CHEERS checklist? It's very important to recognise that CHEERS is only about telling people how to report their work. It does not necessarily prescribe particular methods. However, as you'll see actually when our other speakers give their presentations, it is a bit difficult to totally separate reporting from methods. So, for example, in the original CHEERS, it does ask, in some cases, ask authors to explain why they made particular methodological choices. So it says, report what perspective for your study and explain why, which I think is getting into discussing methods. But really, the existence of a reporting outcome means the following. If you did X or did something about item X, then report it adequately. It doesn't say that you have to deal with item X. For example, the new CHEERS 2022 has a reporting item to say if there was a study analysis plan, could you please let us know where we can access that? It doesn't say you must have an analysis plan, but obviously if you have got one, we'd like to see it. So the existence of an item does not mean that reporters need to address that particular item. However, it could be argued that if we have an item in the CHEERS checklist, it does indicate that this is what we might normally expect to be done in an economic evaluation. So to that extent, It's maybe not prescribing methods, but it's giving people a little nudge in certain directions. So let's turn to the topic of today. Why might extensions to CHEERS be required? Because what CHEERS does represent is the minimum reporting data that applies to all published economic evaluations. That is, this is the minimum we would expect you to report when you're writing up your study. So the question is, well, if that deals with all published economic evaluations, why would we need an extension? And this may be something we could debate later, but I could think of two reasons myself why there might be a need for an extension. The first one is that the paper reports an additional analysis, that is, in addition to the standard economic evaluation, that are not necessarily reported in every case. And CHEERS-VOI is a good example of that, in that not every economic evaluation reports a value of information analysis, but one might argue that if it does report one, there may be some additional requirements you might want to specify for how that should be reported. Another reason might be that the nature of the intervention or program being evaluated is such that additional reporting items may need to be added to the minimum data set. And I think CHEERS-AI is an example of that, where you might well argue that interventions involving AI raise some additional issues in interpreting the work that might justify proposing some additional reporting items so that those additional features were reported adequately. So for starters, that's two reasons why we might want extensions, and maybe some of you listening could come up with more. So what I'm going to do now is move on to our two speakers. We have Natalia Kunst, who's from the University of York, who's going to discuss CHEERS-VOI, and then Jamie Elvidge from NICE, who's going to discuss CHEERS-AI. And what we thought was that since there may be a number of issues that arise equally to both of these extensions, it might be best to hear both the presentations and then have questions on both or them individually at the end. So bear with us while we have the two presentations. And if you have a question at any time, could you put it in the Q&A, and I'll be monitoring that. And when we get to the end of the presentations, I can start leading us through some of the questions that people have proposed. So at that point, I'll stop sharing and turn over to Natalia.
Thank you so much, Mike. I will share my screen. All right. Can you see my presentation?
Yep.
Perfect. Thank you. All right. Thank you, Mike, for the introduction and the great introduction as well about the importance of CHEERS. So in my presentation, I will be discussing CHEERS-VOI, so the extension of CHEERS. And before I start, I would like to acknowledge all our team, all collaborators. I led this project together with Anna Heath, and all the other collaborators, co-authors are also listed here, who contributed greatly to the project. And I would like to also acknowledge Delphi study participants and other Convoy, our group that focuses on VOI analysis members. All right. So medical decision-making and guiding it by performing economic evaluations represent a complex process with many steps involved. Consequently, it is important to appropriately follow all key steps and make all important assumptions transparent to others. And as Mike already mentioned, CHEERS 2022 provides a reporting guideline to improve the transparency, reproducibility, and rigor of economic evaluations. And the value of information analysis can be performed as part or an extension of an economic evaluation to quantify decision uncertainty and determine the need for more evidence to make the decision. And some of the published decision-making frameworks suggest that VOI should be an essential part of the decision-making process. And although the application of VOI has been increasing in recent years, and this analysis requires a large number of assumptions and consideration of input parameters, there was no guideline for VOI results reporting. Consequently, in this study, we aim to provide guidance for the reporting of a VOI analysis performed alongside an economic evaluation by developing the Consolidated Health Economic Evaluation Reporting Standards Value of Information, that is CHEERS-VOI statement, recommendations, and checklist. And the aim of this checklist is to extend the CHEERS 2022 statement, specifying minimum essential information for reporting a VOI analysis, and to improve the transparency, reproducibility, and rigor of VOI reporting. So when it comes to our methods, we started with a literature review to identify candidate reporting items. More specifically, we updated a recent literature review by Kofferberg et al., and this generated a list of candidate reporting items, which was screened by the steering committee. Through this process, we extracted a list of 26 candidate reporting items. 16 of those items were relevant to all VOI measures, and 10 items were relevant to specific VOI measures, 1 for EVPI, 2 for EVPPI, 4 for EVSI, and 3 items were relevant to expected net benefit of sampling. The next step in our method was a Delphi study, which consisted of 3 rounds of web-based surveys. So here, the involved members included Delphi steering committee and Delphi study participants. And the committee nominated individuals who had knowledge of or experience in performing VOI analysis. And those individuals represented a range of fields and geographic locations. And they were asked to indicate the relevance of each item, as well as provide a rationale for their scores and comment on potential changes in wording of items. We got 34 Delphi registrants, and the number of responses for each round were 30 for the first round, 25 for the second round, and 24 for the third round. And these results were reviewed and summarized by the steering committee. So when it comes to the results of each round, in the first round, we received 30 responses, and 21 items received consensus include. None received consensus exclude, and 5 items received no consensus. In the second round, we included 13 items, none were rejected, and 8 items were voted as possible, and this was based on 25 responses. In the third round, we had 24 responses, 12 items were included, none were rejected, and this means that all 26 items proceeded to the 2-day consensus meeting for detailed review, where we finalized the reporting guidance. So the next step in our methods was this consensus meeting, which lasted 2 days. And during this meeting, we discussed and voted anonymously to determine the final checklist. And in this meeting, the steering committee decided to include 20 items, 2 items were merged, and 9 were rejected. And the final step in the method is the dissemination of the checklist of CHEERS-VOI, which we have already started. It has been published and presented at several occasions. So now let's move to the final checklist. So our checklist identified 8 items, CHEERS-VOI checklist items that were already included in the original CHEERS 2022, but required some changes in those those original CHEERS items. And furthermore, we identified 6 CHEERS-VOI items that are new. So first, I will present the CHEERS-VOI items that were already included in the original CHEERS 2022 items, but required some changes. The first one is on the title. So here, VOI analysis should be mentioned in the title. The next one is in the method section. So here, for the study population, if VOI on population level was performed, the checklist asks or recommends to describe and justify how the population who benefits from the research was defined and how the incidence and or prevalence were derived. The next one is on time horizon. So here here we specified that it should be that this time horizon is about the economic evaluation. So to avoid any misunderstanding that it's about, because there is also a time horizon in value of information analysis, but this is already included in the study population. The next item is on discount rate. So here as well, it was required to specify what is the discount rate for economic evaluation and for population level VOI analysis. Those two usually in practice would ally or are expected to be the same, but in theory they can also vary. The next item is with in the section rationale and description of model. So here the item is about describing the model structure and justifying structural assumptions that have been made, because this may have an impact on VOI results. The next item is in analytics and assumptions. Here, the item asks to make sure that a cost-effectiveness threshold that was chosen is stated and justified, as well as to describe and justify the statistical and methodological choices that were made to estimate parameters. And finally, in the method section, we had also one item that was changed on characterizing uncertainty. And here all key structural uncertainties should be discussed, as well as how these have been addressed. And for parameters that were included in probabilistic analysis, it should be described how the distributions reflecting uncertainty were derived. And for those parameters that were not included in the probabilistic analysis, it should be stated why these input parameters were assumed to be known with certainty. And finally, results also, of course, results of VOI analysis should be reported. Next, items that were new. So those are items that were not included in the original CHEERS 2022 checklist. Those included VOI estimation method. So here for each EBPI, expected value of partial perfect information and expected value of sample information. Here the method should be described. Next is the evidence base. So the analyst should discuss the potential risk of bias and heterogeneity in the evidence base, and as well describe whether these were adjusted for in the model. Next, the parameter of interest that were included in EVPPI and EVSI. How the next item is on the study design, study designs that were proposed in VOI analysis. So also here justify and describe and justify how those were chosen. The next two, the last two items were on data generation for EVSI and cost of research studies for expected net benefit of sampling. So I would also like to mention challenges that we met during this project. I think that the most important challenge was how to appropriately align the CHEERS-VOI checklist with CHEERS 2022. More specifically, the CHEERS-VOI items that were embedded in the items of the current CHEERS checklist were already included in CHEERS 2022. However, CHEERS 2022 provided a more general description of the items, allowing for more flexibility, and the steering committee in our study decided that there are some specific items that are very important, some aspects that are very important to be reported if VOI analysis is performed. Thus, we decided that there was a need for elaboration in several of the current CHEERS-VOI items. But but I would like to highlight that those were, it doesn't mean that these aspects were not already in CHEERS 2022. They were included, but we wanted to highlight them given the importance for VOI results. Next, the next challenge was to decide about the appropriate wording of the items to make sure that they are clear and that there is no room for misunderstanding. And I think that was as well challenging and required quite a lot of discussions and in different perspectives. The next challenge was on involving many Delphi study participants and making sure that they continued to be involved in the whole study. And the last one is just to mention that it was a complex and time-consuming process. Still, despite all of these challenges that we met, I think that it was a very rewarding and important project. So just to conclude, in this project, we developed a CHEERS-VOI statement, recommendations, and checklist. And with this checklist, we aim to standardize reporting of VOI analysis to improve the interpretation and comparison of studies and ensure that the analysis provide accurate research recommendations. This checklist represents an extension of the CHEERS statement, and it provides 8 reporting items that require elaboration in the current CHEERS items and 6 new items that require an extension of the current CHEERS items. They represent the minimal essential reporting criteria for VOI analysis. So, of course, more information can be included as well in the paper. And also it's important to mention that this checklist should be used instead of CHEERS 2022 if an economic evaluation includes a VOI analysis. And with this, I would like to thank you for your attention, and I will be happy to answer any questions after Jamie's presentation. And I will just
thank you, Natalia. And we don't have any questions in the Q&A yet, so please send them in as soon as you can. So now I'll turn over to Jamie.
Thank you. Okay, I hope that you can see the slides.
Yeah.
Great. So thank you for the introduction. Thanks to the audience for joining us. My name is Jamie Elvidge. I'm a Senior Scientific Advisor at NICE. And I'll be speaking to you about our extension to CHEERS 2022 that's recently been published. And the focus here is on studies that are evaluating health technologies that use AI to perform their function. So not the use of AI in the economic evaluation, but evaluating AI-led healthcare, AI-enabled healthcare. We led this work through our involvement in the Horizon 2020 project, Next Generation Health Technology Assessment, or HTX, which Mike mentioned up front. But what I'll present here doesn't necessarily reflect the views of NICE, Horizon Europe, or the European Commission. So I'll explain why this was identified as a relevant topic for an extension to CHEERS. But essentially it fits into Mike's second proposed reason that there's something about the nature of the interventional programme being evaluated that warrants additional consideration and potentially additional reporting. Firstly, we're now seeing lots more AI-enabled health interventions. For example, NICE has evaluated and produced guidance about AI technologies that support decision-making in stroke, support diagnostic image analysis in oncology, and radiotherapy treatment planning. And we're almost certainly just at the start of AI applications in healthcare intervention. So this is likely to be a growth area and a new and potentially disruptive field for healthcare, and an area that decision makers might need to have extra confidence about when evaluating new interventions. The NICE evidence standards framework for digital health technologies, the quote there in the blue box, kind of reflects that we expect to see growth in digital technologies with adaptive algorithms that are essentially underpinned by AI methods. And in 2022, the evidence standards framework was actually updated to formally include some evidence requirements about those types of technologies. So again, yeah, I think this speaks to an expectation of growth in these types of interventions in healthcare. So we know this is a growth area. And secondly, we identified that to date, health economics of AI-enabled interventions have exhibited quite important reporting limitations. So this is based on 2 systematic reviews that captured or included 41 evaluations, one authored by Madeline Votes and colleagues, and that was updated by Jay Vitlani and our team at NICE. So we looked at the included studies and asked, is there anything special about AI, the AI nature of these interventions that might require specific consideration by health economists? And in some cases, it looked like the answer to that might be yes. For example, thinking about the potential for AI to learn and adapt over time. That isn't something we typically see in traditional health interventions. And we also asked how well are the AI elements and the implications of the AI nature of the intervention on cost effectiveness being reported. And the answer to that was largely not very well. For example, in some cases, the term artificial intelligence was only mentioned in the title and the abstract of the article. So we thought there was a case there to potentially try and get ahead of that curve of AI-enabled healthcare and explore what an AI-focused extension of CHEERS might look like. And so we embarked on a study to do that. We convened a multidisciplinary expert steering group to guide this work. Had 17 members of that group, from HTA professionals to health economists to AI methodologists, patient representatives and others. So that group reviewed the 41 published evaluations from the literature reviews and pulled together a really long list of potential reporting items, and then refined that into a more practical number for a survey exercise. We then used our networks and snowballing to identify a Delphi panel of experts who we invited to participate in a Delphi study. So from May to September last year, we conducted 3 online surveys as part of that process, with the results of each one informing the next. And we asked for ratings of importance from 1 to 9 for each proposed item, and also welcomed qualitative responses about each item. So this is consistent with the process that was taken by CHEERS 2022, CHEERS-VOI, and recommendations by the Equator Network. And you can see over the 3 surveys and the bullet points, some items were merged or modified over time. And in fact, all of them underwent at least minor modifications to their wording to improve their focus or clarity. We then held a final consensus meeting with a subgroup of the Delphi panel, followed by kind of ratification of the final list of items by the steering group. The steering group then piloted the CHEERS-VOI checklist of items. So in a kind of reviewer capacity, we took some of the studies, a sample of the published economic evaluations from those systematic reviews, and used the CHEERS-VOI items as kind of a review tool. Was it easy to use? Was it clear what we were looking for, what it was asking for? Interestingly, for 5 CHEERS-VOI items, none of the studies we looked at in that pilot reported them in a satisfactory way or at all. But we actually considered that to further support the need for these guidelines rather than being a limitation of the checklist itself. Finally, we asked a digital health interest group of patient experts from Emeritus Rare Diseases Europe, which is the patient advocate partner within the HTX project, to give the items a very focused review from a patient perspective to check for clarity, to identify opportunities that we could use more accessible language and those kind of things. Briefly, this slide shows the composition of our Delphi panel, our respondents by location. As you can see, we had a disproportionate amount of UK representation as the largest group, but beyond that, we did have good representation from across Europe and elsewhere. In each survey round, 70 to 80% of respondents describe themselves as health economists, HTA professionals, or AI methodologists. The remainder was composed of other groups like journal editors, technology developers, clinicians, ethicists, and others. And in each survey, at least sort of 2/3 of respondents had 10 or more years of experience in their stated area of expertise. So we felt like we were reaching the right people in terms of expertise and experience. So what do the results of that process look like? Well, CHEERS-VOI contains 38 items in total. 28 of those are, of course, the original CHEERS 2022 items. And then in CHEERS-VOI, 8 of those original items are elaborated on. So this is consistent with the CHEERS-VOI work that Natalia presented. And this means we identified some important AI-specific nuance or information that a diligent researcher might report, but it's worth stating explicitly alongside that CHEERS 2022 item to ensure everybody reports it when it's appropriate to do so. So the other 10 CHEERS-VOI items are new, and they extend upon CHEERS 2022. Again, these are items that probably go beyond elaborating on an existing item, where there's a really important feature of AI that's been identified that should be reported and might not otherwise be captured. So here are the 10 new CHEERS-VOI extension items. I won't go through this list one by one. The paper has now been published in Value in Health, so you can inspect them more closely there. But a few particularly interesting ones are, I think, the importance of reporting or citing how the AI algorithm itself was developed and validated. If the AI has the potential to learn over time, how is that measured and how has that been captured in an economic model if there is one? And the need for discussion around additional requirements regarding the implementation of a potentially very novel, disruptive intervention into practice. What does that mean for cost-effectiveness conclusions? And among the 8 elaborations on an existing CHEERS 2022 item, some notable additions include, well, the big one there in the middle, a lot of detail relating to the intervention and comparators to explain what it is, what's the AI doing, how it works, describing in detail what's included in the AI purchase cost, which might be, given that this might be embedded in digital health technologies, might be different to a standard one-off cost. And the need for discussion around potential biases and ethical concerns that might be introduced with using AI. So while I didn't go on into detail one by one, I will talk a bit more about some of the key features of CHEERS-VOI now. And these are things that we heard from experts throughout the Delphi process, and that we'd advise health economists reporting their studies to think about reporting if relevant. And also people might use CHEERS-VOI in a review capacity. So something for reviewers to look out for as well. So with AI, there's an additional population of interest. So for traditional healthcare, we might be concerned about the generalizability of the trial or model population versus the real world. But with AI, we probably also have a third population to think about in that context, the training data set, the data set that the AI algorithm or model learned from. I mentioned the validation of the AI algorithm. Some methods like generative AI are inevitably going to be somewhat opaque. So a reviewer or a decision maker needs to be comfortable that the intervention has been developed and validated appropriately. Many AI interventions that we've seen to date support decision making or support diagnosis. These things have indirect routes to generate an increased patient health gains. So that mechanism needs to be clear, reported, hopefully plausible. Version control, like I say, we expect AI to be typically embedded in digital health technologies for the foreseeable future. So what version is being evaluated? What happens with future versions? What if that's in the very near future? They've been captured in the analysis in any way. I mentioned learning over time. If that's something that the intervention can do at the individual level, if you can imagine, say, a wearable device that has AI methods embedded, that kind of learns as it's being used and provides better feedback, better care to the individual using it. How was that measured? How was that modeled? What assumptions have been made around that? We're very used to seeing economic evaluations that assume some sort of treatment waning over time. Perhaps the opposite might be plausible here. In terms of the AI costs, we heard, like I said, that there's likely to be some variation between those that are just an upfront payment that we often see with medicines and traditional healthcare, and more ongoing or subscription type costs. There might be multiple different ways to deliver a supportive AI-driven service with cost implications. And the more disruptive or technically challenging an intervention, the more likely it might be to incur wider implementation costs. So these are things to look out for or to report if they're relevant. The use of AI also introduces some potential biases. For example, it could serve to exacerbate existing health inequalities based on the data that it's learned from. So has that been discussed? Has that been reflected on? And lastly, we heard from a couple of respondents that many of the items in CHEERS-AI could equally apply to diagnostic technologies in general, or even digital health technologies in general. So perhaps there's a case for a bigger kind of CHEERS DHT or CHEERS DIAG piece of work there, but that was beyond the scope of what we were doing here. So for those in the audience who might be considering or even in the process of developing an extension to CHEERS or a different reporting standard, here are some practical considerations that we think are worth thinking about. Firstly, this isn't a quick task. You need to have resources in place to lead this kind of study, and it's important to maintain momentum. You don't want to leave a long gap between survey rounds, and so necessarily the analytical work and survey design in between survey rounds is quite intense. We'd recommend giving close thought to the steering group or working group that you want to lead the process. So ensuring you have a really good representation of relevant expertise while maintaining a practical group size, because it's this steering group that essentially you'll want to have the final say on everything, every decision that's taken. Like Natalia mentioned, recruitment to a Delphi study can be tricky, especially over the height of summer, which we found with CHEERS-AI. So there's a need to really promote it and chase people for responses. There's also a potential trade-off, we think, between casting the net wide and having a very broad Delphi panel welcoming input from a really wide range of stakeholders, which gives you a much bigger sample, different perspectives, and can help kind of mitigate for the likely attrition between surveys, versus having a small and much more highly targeted panel, which might allow you to focus on the experts whose responses you'd weigh most highly, the people you really want to get to, whereas those voices might be lost as part of a bigger sample. So there's a trade-off there potentially. In terms of managing survey responses, I would recommend allowing qualitative responses. They were a wealth of useful information for us, allowing us to merge items, tweak items in a way that we wouldn't otherwise have thought to. But do be aware that requires proportionately more analytical work to analyze and theme qualitative responses. We did receive some conflicting responses, both between different respondents, which you'd expect, and occasionally by the same respondent. For example, somebody would rank an item as being very important to include in CHEERS-AI, but then state in a qualitative response that this item isn't needed because it's already covered by CHEERS 2022. So there's a conflict there about whether that's actually important for the purpose of CHEERS-AI or not. So I'd recommend being very clear in any communications about your instructions, the objectives of the work. And I'd also recommend having a pre-specified protocol to help steer you through those sorts of issues, which should include, I would recommend including a kind of final say clause for your steering group to resolve issues, have the final say as needed. So just to reiterate, that we developed CHEERS-AI within the HTX project, which is now concluded, but you can go to the project website here to learn more and see its many other interesting outputs. And I was lucky to have a very engaged expert steering group, many of whom gave up their time willingly to help guide this process and develop CHEERS-AI. So thank you to everyone on the screen, including Mike and Don Hussereau, who were open to this extension and supportive of it from the very start. And thank you for listening in the audience. Please do check out the full publication of CHEERS-AI, and if you use it, it would be great to know. Please let us know what you think.
Thanks, Jamie. And so let's go on to questions. I've had 2 or 3 already. There's one general one, which is for both of you really, and that is, how did you actually get this process started to develop an extension to CHEERS? And are there any approvals or paperwork that you required? And maybe Natalia, do you want to start with that one?
Yeah, sure. Thank you, Mike. And thank you to the person that asked this question. Well, that's a good question. It's been a while now, but I think we, as part of, as I mentioned, I'm part of Convoy Group. I'm a co-founder and co-lead of Convoy Group. That it's a group of researchers that focus on value of information analysis. And we just discussed the lack of this type of guidelines, so the need of guidelines to make sure that reporting and conducting of VOI is appropriate. And I think the first step for us were actually to reach out to you, Mike and Don, and just ask what is the best way to start. We got a great advice on that, but other than that, I think we've just looked into previous guidelines, both, of course, CHEERS 2022, because that's the one that we were extending, but also the previous ones, and checking how the methods, how this should be performed, and to make sure that all the methodological aspects are also correct. So I wouldn't say that there were any requirements to actually perform a study like that. We did this in our, without any funding, so as kind of as Convoy Group as well, so more as our free time hobby.
Thank you. Jamie, do you want to add anything to that?
Yeah, briefly, I think the first step for us was we had a master's student placed with us over the summer with an interest in AI and an interest in economic evaluation. So they kind of led the initial exploration around updating that systematic review. And it stemmed from there. So we identified the need for CHEERS-AI sort of kind of organically. And then, as Natalia said, there was no formal process. We reached out to you and Don. At that time, that actually aligned really nicely with the AI update to our evidence standards framework. So that was good. We did, of course, reach out to the Equator Network, make them aware that this was in progress or in planning. And we sought ethical approval, of course, but yeah, nothing formal beyond that. But it's important to identify the need and get people on board with that first, I think.
Thank you. I mean, just so I add for everybody's information, in the CHEERS 22 report, all we say is that we'd appreciate it if people developing extensions or translations into other languages would inform us of their intentions. But as Natalia said right at the beginning, these are independent initiatives by researchers, and there's absolutely no requirement to even talk to the CHEERS people. If you don't like them, for example, you can just go off and do your own work. So this is not to restrain anybody from anything, but it would be great if we did know on CHEERS, because we could maybe give some advice and give more general support to groups wanting to develop extensions. We're getting quite a few questions now, but I just had a quick follow-up, which I think is important to people thinking about this, is that if we look at both the case of VOI and AI, I think it was fairly clear that there were not adequate reporting guidelines in existence, but that doesn't mean those guidelines needed to be an extension to CHEERS. You could have done it independently. And I just wonder, I know particularly for VOI, you went through this process at one point, but what would tip you one way or the other? If you were giving advice to somebody who's identified a need for reporting guidelines, what would you say would push them towards CHEERS rather than kind of going alone, so to speak? Natalia, do you want to?
Yeah, sure. Thank you, Mike. Well, I think so. We did perhaps consider that as well, because VOI can be performed as part of an economic evaluation, or it can be performed as standalone analysis. So I think that was one of the decisions as well, that we wanted to, even though the checklist that we developed can be as well applied to a standalone analysis, but the analyst should make the decision whether what items are relevant in that case. But we decided to go for to focus on a VOI analysis that is performed alongside an economic evaluation. And I think because of that, it was for us natural to focus more on to take CHEERS 2022 as a start point, because those are the guidelines that are the most commonly used and acknowledged as well for economic evaluation. So I think that we wanted to make sure that we base that's our fundament to build our guideline and checklist. And that's why as well, I think it was very helpful, even though, as you mentioned, it's not necessary to reach out to you or Don, but it was very helpful as well to make sure, because as Jamie mentioned, it's a very complex process. So we wanted to make sure that we don't make any mistake during the process, and then we have to do everything from the beginning, which I think was very valuable to have your thoughts and your help in that as well.
Okay. Thank you. Jamie, I won't ask you the same question because we've got some other ones coming up here. One is in particular with learning of AI algorithms over time. Has NICE studied at that? Or are there examples where you've looked at the learning over time of AI intervention?
We haven't yet. Thanks for the question. We haven't yet seen any interventions be submitted to us for evaluation that have that capacity. The AI interventions that we've assessed so far, the 3, are fixed algorithms without that kind of adaptive learning capacity. So it was noted as part of our Delphi process that reporting standard might not apply to every evaluation, but it's kind of future-proofing, it's seen as future-proofing CHEERS AI, reflecting that this is an early stage in AI being embedded in healthcare interventions. So that's something that could feasibly happen in the near future, but we haven't seen it yet at NICE.
There's a couple of other questions, particularly on AI. One is that someone notes that there are other guidelines that focus on budget impact of AI or digital health. Are you aware, or do you think there should be some similar checklist questions for budget impact assessments of AI or budget impact aspects of AI?
I'm not aware of any, but I think the potential interesting nuance there is if AI technologies are particularly disruptive, they do potentially, given that they may be supportive, they may have the potential to shape care pathways quite significantly, or even you can envisage an AI application to make process improvements at the healthcare delivery level. Those kind of things might have really big budget impacts. So it'd be interesting to see if there are specific nuances there. I'm not aware of a budget impact checklist specific to AI though.
Okay, thank you. There's another one which is a general challenge. It's given in the context of AI, but could apply to VOI as well. And that is that if you look at the list of new items, in the AI, CHEERS-VOI, it's clear that validation of algorithms specifically relates to AI. But how many of the others do you think are specific to AI rather than medical technologies in general? I think the question here is really, how is what both of you have done improve the general CHEERS checklist as well as or rather than added questions related to a particular technology or method?
Thank you for the comment. I hope it's an improvement. I'd say there are a few more CHEERS-AI items that are AI specific, things around learning over time, things around particular important biases that we know about around AI methods. So I think there are a few. I accept the point that some of our items may be applicable to digital health technologies more broadly. And I reflected that on the slide. That came out as part of our process. Maybe there's a broader piece of work there as well that was, I'm afraid, out of scope for us. But I think it's a fair comment.
Yeah. So, Natalia, is any of yours that you thought were almost improving the general CHEERS checklist rather than be specific to VOI?
Well, I wouldn't want to say that it was improving. I think we had this change. I remember how to actually align what we found to the CHEERS 2022, because CHEERS 2022, as we discussed, provides a more general, very often guideline on several items, so for example, when we stated, well, you should state cost effectiveness threshold, and then in CHEERS 2022, that's also included, but it's not stated explicitly. While we felt for VOI, it's necessary to be clear about that because it plays an important role for the results as well, and transparency. So I wouldn't say that it was improving. I would say that there were some aspects that needed to be more detailed, while in CHEERS 2022, there is more flexibility for the analyst, which may be, perhaps some may find it more challenging as well, because maybe they are not sure whether they should include it, or specific aspects, whether they should. But I think at the end, it's also up to the analyst, because as you, Mike, mentioned, those are suggestions, those are recommendations. So those are not kind of requirements, but those are recommendations to improve the transparency.
Thank you. I've just got another one I've got time for. This is really thinking to the future about other areas for extensions. And the specific question is, do we think there should be an extension dealing with environmental impacts or aspects of economic evaluation?
Yes.
Yeah.
I answered this in the chat because I was conscious of time, but I think there is a potentially a useful addition there, and we understand that CHEERS Climate is actually in development by the University of Bremen, is underway. I think the methods around embedding climate outcomes in health economic evaluation are still very much in development. There's not quite consensus around how to do that all the time yet. So there may be a methodological evolution there at the same time, but it certainly feels like to me that would fit into your kind of first category, the CHEERS-VOI category of a different type of analysis that warrants specific attention.
Yeah. Okay. Thank you for that, Jamie. So I think we should finish because we're a minute over time. So I'd like to thank both of our speakers for their contribution and for all of you that attended, and I hope you got something out of it. So we'll conclude the webinar now. Thank you.
Thank you.
Thank you.